Good day. My name is Mubarak Yusuf. Today we'll be discussing key point on what key point to look for when you're differentiating between TTP, ITP, and HUS. Those are three platelet disorder, quantitative platelet disorder, problem with primary hemostasis. So what are the three major difference you should look for when you are looking at ITP, TTP, and HUS? First, both of the three of them are what? Are quantitative defect. So therefore, the bleeding time will be increased. There will be increased bleeding time because there is low platelet. What is the pathophysiology behind ITP? Pathophysiology behind ITP is when there is what? It's an autoimmune. It's immune thrombocytopenic purpura. That is, there's an autoimmune production of antibodies against what? And auto antibodies against the receptors of what? Of the platelet. Receptors such as GP2B3 3A. Receptors such as GP2B3A. Then what is the pathophysiology of TTP? Pathophysiology of TTP is when you have ADAMTS13, destruction of ADAMTS13 leading to what? Or decrease ADAMTS13. What's the function of ADAMTS13? ADAMTS13 helps to cleave what? It helps to cleave multimer of von Willebrand factor. It helps to cleave the multimer of von Willebrand factor. What is HUS? HUS is when you have infection with E. coli 01578 which produce what? Vero-like toxin. Vero-like toxin, what do? They destroy this 60S ribosomal subunit, and this will also there's some study that also show it's also associated with decrease in ADAMTS13. Now that we know the pathophysiology of them, now we go into what is the difference. How do you differentiate them? In ITP, what we have is that you can have the acute form or you can have the chronic form, right? The acute form, you see it in children post-viral infection. So when you get a question whereby they say a child post-viral infection, suddenly they develop decreased platelet, increased bleeding time, then that's most likely ITP. When they tell you in maybe 30 in a woman, adult female, in a 20 to around 40 years of age, whereby she have maybe another autoimmune disorder such as SLE. Now suddenly develop decreased platelet count, right? That's most likely leaning toward ITP. TTP and HUS. This one is a bit confusing for most students because they have similar symptoms, right? The symptoms do overlap. So there's a mnemonic for you to remember the symptoms of TTP and HUS. There's this mnemonic FATRN, right? F standing for fever, A standing for anemia, T standing for thrombocytopenia, R standing for renal defect, and N standing for neurologic defect. So in this condition, in TTP, you will have this 5 pentad: fever, anemia, thrombocytopenia, renal disorder, and neurologic symptom. While in HUS, you will only have 3 of them. That is, you will have anemia, thrombocytopenia, and renal defect. Why are we having anemia in TTP and HUS? You have anemia because of an anemia called microangiopathic hemolytic anemia. Because of failure to cleave Willebrand factor, now there will be microthrombi formed in the blood vessel, and that will lead to what? That will lead to sharing of the red blood cell, and you see something called schistocyte or Hellman cells, right? That's the anemia you see in TTP and HUS. But what is the diagnostic criteria for TTP? Two things you need to see for you to diagnose TTP is what? Anemia, that is microangiopathic hemolytic anemia, and what? Thrombocytopenia. Those are the two things. In HUS also you need anemia, thrombocytopenia, and renal dysfunction. But what kind of patient would you see TTP, and what kind of patient would you see HUS? In TTP, you see this in patient, for example, in middle-aged female. You can see this in middle-aged female also. While HUS, you see this mainly in kids. You see this in children, for example, around the age of 5, 10, and they will give you a history of eating a burger or eating a beef, uncooked beef, not well cooked beef, and you know they've been exposed to E. coli. So just a quick recap. How do you differentiate ITP from TTP? Both of them will have increased bleeding time, but ITP will be what? ITP will be either post-viral or in a chronic setting whereby the patient will have another autoimmune condition. Also, when they mention bone marrow aspirate will show megakaryocyte. The bone marrow will show megakaryocyte for what? For ITP. For TTP, you will have anemia. In ITP, you will not have anemia. In TTP, you will have anemia. In HUS, you also have anemia. In HUS, you have what? Anemia, thrombocytopenia, and renal dysfunction. In TTP, you have fever, anemia, thrombocytopenia, renal dysfunction, and neurologic disorder also. So you have 5 of them in TTP, you have only 3 of them in HUS. Those are the main difference, the way you differentiate TTP from HUS. Again, ITP, no anemia. TTP and HUS, there is anemia. ITP, there is megakaryocyte in the bone marrow biopsy. TTP, there's no megakaryocyte in the bone marrow biopsy. And HUS also, there's no megakaryocyte in the bone marrow biopsy. Please take note of that. Please take note of that. Thank you very much. See you next time as we discuss other confusing topic.